This device is recommended as part of treatment in case of chest contusion, rib fracture, or floating chest to prevent paradox breathing and following thoracic surgery. While wearing the splint, the movements of the ribs are decreased, thereby decreasing pain. Less pain helps to allow adequate deep rest to promote ventilation of the lungs, decreasing the chances for complications later on. Orthoses in the Chrisofix family are composed of multi-layers of breathable medical-grade materials. The rib splint consists of layers of foam and moldable aluminum core for a precise fit and good efficiency around the affected area. Another advantage of the Chrisofix Rib Splint is that it's radiolucent, allowing for assessment of the patient progress on radiographs. The fracture or fractures need to be localized with X-ray before application of the splint. Patient should be in a sitting or standing position, preferably not lying down when the splint is applied. Patient should assume a straight posture as much as possible. Good posture aids proper application of the splint. Skin should be void of hair and degreased before application of the splint. Pre-formation of the splint should be done on the non-injured side of the chest. Adjust the arrow-marked surface of the splint to the chest so that the direction of the arrow follows the ribs. Pull off the paper cover sheet marked with the arrow from the arrow splint surface. Apply the splint to the fractured region while the patient exhales. The splint has to bridge the fractured area. While the patient inhales, remove the paper cover sheet from the bottom of the waterproof foil and press the adhesive foil edges to the skin. Using the flap on the outer surface of the splint, remove the outer see-through foil. This will make the waterproof foil breathable. Do not leave this last cover sheet on the splint and only remove it as a last step, otherwise the splint is not usable. The length of treatment depends on the type and severity of the injury and how long the patient suffers from symptoms.